Epidural injections are a common way of managing chronic pain in adults. What happens in this day and age is somebody may have back problems. They have chronic pain in their back, but they don't want to have back surgery. Back surgery may not be indicated. And the doctor may say, or may recommend, go get an epidural injection. Now, you think that's just some benign process, they put a needle in your back and they inject a steroid in there to decrease the amount of inflammation and hopefully alleviate your pain. Unfortunately, if a doctor isn't careful, when they place that needle, and they need to place that needle in a very small space, right next to the spinal cord or a nerve exiting the spinal cord, and if they're not very, very careful, they can injure it. And unfortunately, at CPW, we've had cases where doctors weren't careful, and somebody walked in for a simple epidural injection, but never walked again, and ended up paralyzed from the waist down. And so, if you or a loved one have gone in for an epidural injection, but unfortunately things went very wrong, and you can't walk, you're having difficulty controlling your bowels, and that's a common complication, or not a common complication, but it can occur if a doctor isn't careful. You should give us a call. We've handled many of these cases, and sometimes it can't be avoided, but oftentimes it could have been with just a couple easy steps that the doctor did not follow.